Have you ever noticed how some family traits, like a particular eye color or a strong sense of humor, seem to get passed down through generations? Well, just like those delightful characteristics, certain health patterns and conditions can also follow family lines, giving us important clues about our well-being. Recognizing inherited condition symptoms starts with observing your family's health history and understanding the subtle signals your body or your children's bodies might be sending. It is about connecting seemingly isolated health events to a larger, inherited picture. The core reason some conditions run in families lies in our genes, the instruction manual for our bodies. We inherit two copies of every gene, one from each parent. Sometimes, a change or mutation in just one copy of a gene can cause a condition to appear, which is known as dominant inheritance. Other times, a condition only appears if you inherit two altered copies, one from each parent, which is called recessive inheritance. There are also X-linked conditions, which are carried on the X chromosome and often affect males differently than females. Understanding these basic patterns helps explain why symptoms might appear or skip generations, impacting how they manifest. To actively recognize these symptoms, begin by building a detailed family health history, tracing back at least 3 generations on both sides of your family. Look for recurring health issues such as certain types of cancer, heart conditions, or neurological disorders that appear in multiple relatives. Pay attention to patterns like early onset of disease, unexpected medical complications, or symptoms that seem unusual or severe compared to the general population. For example, if multiple family members developed heart disease before age 50, that is a significant pattern. Also, consider any developmental delays or specific physical features in children that might not be typical. An insider tip for being a health detective is to focus on clusters of symptoms rather than isolated incidents. For example, unexplained fatigue paired with muscle weakness and a specific skin rash might, together, point to a genetic syndrome. Genetic counselors often refer to these as red flags, which are specific combinations of findings that alert them to a potential inherited condition. These professionals are like expert genealogists for your health, connecting the dots through generations. It is also very helpful to document any unusual or persistent symptoms you or your family members experience, even if they seem minor at first, as they could be vital pieces of the puzzle. Ultimately, recognizing inherited condition symptoms empowers you to take proactive steps for your family's health. By carefully observing health patterns and symptoms within your family tree, you can open up conversations with healthcare professionals, gain clarity, and access the right support and care to plan for a healthier future.